Hello everyone, how are you today? So just I discuss about the pituitary gland hormones of the anterior lobe. Today I'm going to discuss about the posterior lobe hormones of the pituitary gland. So firstly is the oxytocin and second is anti-diuretic hormone. Anti-diuretic hormone is also called the vasopressin. So oxytocin is stimulated by the secreted by the hypothalamus but stored in the posterior pituitary gland. And whenever is needed, the posterior pituitary gland is secreted in the blood and in the body. So oxytocin helps in induction of the labor, also like when there is a postpartum bleeding, and also help like if there is incomplete abortion. So also like a letdown of the milk during the lactation and after the delivery of the delivery of the baby is helping the letdown of the milk. So oxytocin is always we are giving through the intravenous route. So whenever we are giving intramuscular route, so always we need to check for the aspiration through the needle because it can go through the blood vessels. So oxytocin, there is one question in the NCLEX, it can come also. Like it's very important, like when the patient is on oxytocin and patient have the hypostimulation of the uterus, but the baby is non-assuring heart rate. So what is the action of the nurse? What the nurse will do in that situation? So in that situation, firstly stop the oxytocin and put the patient on her side. Because why on her side? Because for the placental oxygenation, and immediately tell the another nurse like call the doctor, because in that situation we can't leave the patient alone. So after that we need to go for the IV, like IV normal saline, we need to fast that rate, and also we need to be put the oxygen on through the face mask. And after that, when everything is completed, we need to check the fetal heart rate, mother heart rate, and also we need to be check for the contraction intensity and duration of the contraction. So next is the anti-diuretic hormone. Anti-diuretic hormone, as I already tell you, like it's also called the vasopressin. It's also secreted by the hypothalamus, but is stored in the posterior lobe of the pituitary gland. So whenever needed, is secreted in our body. So anti-diuretic hormone, when it is secreted when there is dehydration, when there is too much salt intake in our body, and when there is a blood volume is less. So anti-diuretic hormone is very important for our body. It's help in the absorption of water in the kidneys, and this hormone, if there is less, or is called the diabetes insipidus. So during diabetes insipidus, if too much, there is polyuria and too much water is out from the body, so it's very essential to immediate treatment, otherwise dehydration will occur. So immediately we need to take the action. So these are all about the posterior lobe hormone, there's the oxytocin and anti-diuretic hormone. And please so at last, please share and like and subscribe my channel, and see you in next video. Thank you, have a good day.